Hi, I'm Cory Christiansen with Steindler Orthopedic Clinic. I'm going to talk to you today about ACL reconstruction surgery. First thing you need to know about ACL reconstruction is what is the ACL and what does it do. And so I'll give you just a brief synopsis of knee anatomy. And in the middle of the knee there's the ACL and the PCL, and that stands for the anterior cruciate ligament and posterior cruciate ligament. And what they do is they help prevent the knee from going too far forward, which is what the ACL does, or too far back. And so what generally happens is somebody's running at a high rate of speed and they try and change direction quickly, and the tibia goes too far forward, and that ruptures the ACL. And that's usually accompanied by a pop and pain, and then usually a large amount of swelling in the knee. The problem with an ACL is that it doesn't heal, and you can't go in there and just suture it back together. And so you have to come up with a way to reconstruct the ACL. And so there's different ways we do that. One way is taking some hamstring tendons that come around the inside part of your thigh. We can usually take 2 of those tendons and make a new graft. A second option is using part of the bone of the kneecap, part of the bone of the shin bone, and the tendon that goes in between, and that's called a patellar tendon graft. And then the third option that we generally use is allograft, or donated or cadaver tissue. And it really is up to the patient as to what graft they want to use. And then we make a small incision. If it's a hamstring, we make a small incision over the front. If it's a patellar tendon, we make a little bit bigger incision over the front of the knee here. And if it's a donated tissue, we can usually get by with that small anterior incision. And then we make a couple small poke holes that we can place a camera and some instruments through, and then generally one other incision either on the inside or outside part of the knee. We then place the camera inside the knee joint, and we evaluate the whole joint itself and make sure that nothing else is injured, being that cartilage, meniscus, whatever. And then we can go in there and clean out the portion of the ACL that's torn. We then use specialized instruments to make a tunnel through the shin bone, and also a tunnel far back into the femur here, and that's going to basically recreate the anatomy with the graft that we've made. And then through those same incisions, we pass the graft up through those 2 tunnels, and we fix it with either a button or a screw on either end of it. And that pretty much stabilizes the knee. And we then generally place our patients in a brace and a soft dressing, and we get them started on rehab right away. Rehab generally involves a physical therapist for 3 to 6 months. We try and get patients back to activities around 7 to 9 months afterwards.